I travel to India more frequently now, and whenever I come, there is a new IVF clinic that is popped up.
Yeah.
But as a consumer, what should I look for? How do I know about a low standard clinic or high quality where all these things are happening?
When a couple has to decide which clinic to go to, there are multiple things. It's not just a clinic that looks very posh or looks like a five-star hotel, but what is happening behind the scenes? How experienced is the doctor? It starts with that.
The gynecologist.
Gynecologist. Because one of the main things on which the couple's success rate depends is how gently and atraumatically could your doctor do your embryo transfer.
Inside the uterus.
Inside the uterus, the embryos are very delicate. If there is any kind of trauma, contractions, the embryo will get expelled. So the number.
But as a gynecologist, that is so nerve-wracking, right?
It is. It's actually, newcomers, juniors who are about to start fertility practice or keen on starting fertility practice, they think that embryo transfer is so easy. The egg retrieval is difficult. It is actually the other way around. Because your outcomes depend on how smoothly you can do an embryo transfer. So your doctor's experience matters not just on that, although that is a very important part of the IVF process. But where it starts is that it's not a one size fits all. Every couple requires personalized attention. Getting the difference between failure and success is often not one path breaking moment. It's doing every step right. It's doing an in-depth analysis, understanding which protocol will work better for which patient. And that can make the whole difference between a couple that hadn't yet conceived and now will.
Correct.
So that comes with experience, that comes with wisdom. This is a very difficult journey. Infertility is very difficult to go through. It's emotionally draining, it's financially draining. Is your doctor approachable? Is your doctor there for you when you need her or him? Or maybe they are very good at their work, but they just are so busy, they don't really have that much time to talk to you. That human factor, the tender loving care, is so important in this field, in any, but especially here. There's a very beautiful quote by Carl Jung that I love. It says, "Know all the theories, master all the techniques, but when you touch another human soul, be just another human soul." So if your doctor can provide that to you, I tell my patients, you did not sit at home and send your uterus to me. You came to me, a whole human being. So your holistic care, including taking care of your emotional well-being, is part of what I am here for. In the Europe now, they have started talking about, when you talk about success rates, it's no longer enough to know how many patients conceived. One of the parameters has to be how easy was the patient's journey. I tell the couples the path to parenthood is a pleasurable one. At no point will we ever let it become a painful one.
Because the painful one is after.